In this part of my jaw joint surgery series, I'm going to talk about how traditional orthodontics hindered my palate expansion and my jaw growth, leading into my inevitable jaw joint surgery. If you didn't watch the previous part, my surgeon basically replaced both my TMJ joints right here with polyethylene and titanium replacements, since my original jaw joints were arthritic and barely functioning, giving me lots of jaw pain daily. I will go into more depth later on the exact particulars of the jaw surgery, but first I'm going to give a quick, brief medical summary of what happened before my jaw surgery, so it makes things easier to understand. My jaw surgery journey started when I was 12 years old, when my orthodontist noticed a deficiency in my lower jaw, giving me the buck teeth look as a side effect. In the orthodontist world, this roughly affects 25% of patients. So for my orthodontist, this really didn't seem like a big deal to him or me at this certain period of time. But traditional orthodontics really has no concept of airway space, palate expansion, facial balance, which I did not know at the time. And the study rather finds the quickest way to straighten your teeth and align your bite in the quickest amount of time possible. Most of that time, that includes pulling permanent teeth to make space, which in turn narrows your airway over time. In my case, the headgear which they gave me brought my front jaw all the way back to my lower jaw, leaving me with practically very little airway space, which is almost equivalent to me breathing through a straw on a daily basis. Although my bite was aligned by traditional orthodontic standards. The braces also made my upper and lower palate narrower, which caused poor sleep, daily headaches, and fatigue throughout the course of 6 years before my jaw surgery. Fortunately, a lucky diagnosis of obstructive sleep apnea by my orthodontist directed me and my parents into a new direction, into a new branch of orthodontics called orthotropics. And I quote, "Orthotropics is a philosophy and treatment focused on proper and harmonious facial development by correcting unfavorable growth patterns in your upper and lower jaw." To make a long story short, I just started to wear braces and new appliances like this that help guide my lower jaw forward and also make my upper palate and lower palate wider than normal. But it only helped slightly because I was caught late in the growing process around age 13, which is when a majority of your jaw growth is already finished. There would have been substantial changes with orthotropics if I was caught during the ages of 6 to 9 instead of a couple years later. I can go more in depth on the study of orthotropics and the reasons behind poor jaw development another time. Everyone right now, hits the like button and subscribe so you can get more content like this. Fast forward to age 15 and I gave up on the appliances. The Adapt, a painful and complicated orthotropic appliance, only gave me 3 millimeters of forward growth after wearing it for about 2 years nonstop, day in, day out. So instead of putting myself through more pain, I decided to wait till age 18 to have a permanent MMA jaw surgery to correct my jaw and facial abnormalities. They also had to move my jaw around 25 millimeters to reach the conventional standard of strong facial balance. Also, I would have had it beforehand, but it is not recommended to have the jaw surgery before age 18 because if you're a male, your jaw is still growing. Females can have it a little earlier, around ages 15 to 16, since they mature earlier. It just depends whether you're fully grown or not. In those 3 years of high school, my mandible unfortunately regressed and my teeth became crooked again, giving me an unfavorable look since I wasn't wearing my appliances day in and day out. Additionally, my sleep apnea was so bad that I had to take narcolepsy medication, as well as many cups of coffee just to stay awake in class and compete in varsity sports. Also, I had constant neck pain and poor posture due to the protruding of my head in a way that was easier to breathe with my very little airway space, and to make myself look like I had a somewhat near normal profile. By doing this for a number of years, it severely weakened my neck and trap muscles all around right here to a point where I had to start taking yoga classes and stretching 30 minutes a day. As you can imagine, I was more than happy by the time I turned 18 to finally have this jaw surgery. But in order for the surgery to have a more optimal outcome, I underwent nearly a year of aggressive orthodontics in summer 2019 and ending about a year later on my surgery date around September. This phase included giving me braces to expand my upper palate, as well as giving me space in between my canines right here and my lower incisors to have enough space in between my teeth for jaw surgery. I also wore an invasive lower expander, just like this one right here, to expand my lower palate as wide as possible in the littlest possible time, in turn giving me a lisp that I had to deal with throughout my entire senior year of high school, especially during debates and during presentations in class. Let's just say it was not a very fun time for me. And of course, as you know, as the surgery date approached in 2020, COVID-19 happened. The surgery date that was supposed to take place in Missouri was indefinitely postponed, and I was crushed to hear a surgery that I was waiting half my life for was suddenly postponed. And these COVID mandates only allowed in-state patients for the surgery, since all the hospitals at that time were filled to the brim with infected COVID-19 patients. That meant another year of wearing braces, or else my teeth and jaw would misalign, since nothing would be holding them in place if I decided to take everything off. And I previously have worn braces for 6 years of my life, which is insane if you think about it. As my chances were becoming slim, my family and I started looking for various substitutes in Dallas, Texas to see if I could have the surgery during COVID-19. So I was back at square one, and all I could really do is wait and pray that the surgery would finally happen. To make matters worse, the prosthetic jaw joints that were made specifically for me would expire at the end of the year, costing my family $17,000. When all hope seemed lost as I was preparing for my first semester of college with constant fatigue, a shocking phone call from the hospital in early August said they now had a final opening on September 3rd, 2020, due to COVID-19 patients inside the ICU finally went down. I was in awe how quick my luck had changed. Due to the fluctuation in COVID patients, my surgery could have been pushed all the way to next year. So I canceled all my fall semester classes, and the month before jaw surgery, I prepared vigorously through specific dieting and daily exercises to ensure the best possible outcome. Thanks for watching the first part of this video series. If you enjoyed it, it would be great if you could just hit the like button, comment a question, or just subscribe so the YouTube algorithm could recommend this to other people who would greatly benefit from a video like this. And yeah, the second part will be coming out soon. I just have to edit it a little bit more. And yeah, that's it for now.